if you look at all of the studies on meditation, basically the ones that show a clinically significant change do a practice for at least 3 days a week, 20 minutes a day for 8 weeks. So when I'm treating someone with depression or anxiety, I tell them, if you want to see a substantial benefit to your depression, let's say what you would get from an antidepressant or an anti-anxiety medication, it's going to take 8 weeks of practice for 3 days a week at a minimum for 20 minutes. So I'd say that you should practice for, I'd say give it 2 months where you're practicing 3 to 5 days a week. That being said, I've found a lot of value. Like, some people feel great after like 3 minutes of meditation. So I think a lot of the confusion around meditation, when they say, how long does it take to be effective? It depends on what you're doing, right? There are different kinds of meditation. And if you're not doing the right kind of meditation technique, it's not going to feel effective. So the problem isn't that you're not doing it long enough. It's that you're doing the wrong thing. And so it's kind of like asking someone, like, how long does it take to get good at falling asleep? Well, it sort of depends on how you're falling asleep. Like, are you drinking caffeine before you fall asleep? Because for some people that doesn't matter. And for some people it matters a lot. Are you sleeping in a room with no noise or a lot of noise? Because some people like sleeping with the TV on. Some people have to sleep in absolute quiet. Are you sleeping under the covers, or do you like to have like a cold room and under blankets? That's what I like. I like sleeping in a cold room with a bunch of blankets. Other people like sleeping in a warm room with a thin sheet. People have different ways to sleep. And so different meditation techniques are important because, like, you have to do one that fits your cognitive and your neuroscience fingerprint. The reason there are different kinds of meditation techniques is because our minds are different, our brains are different, and to calm the mind requires a different technique for a different kind of mind. And so, so someone's saying, I get really frustrated and angry with meditation. Is that normal? Sure. So my guess is that the reason that you're getting frustrated and angry with meditation is because it's not doing what you expect it to do, which in turn is the problem, because as long as you hold on to an expectation, you're not going to enter a meditative state. So, like, it's absolutely frustrating, right? Like, yeah, because you're holding on to an expectation. The expectation prevents you from attaining the state of consciousness that meditation is, which in turn frustrates you, and it's because you're expecting. So the way for bigger B1 to meditate is for someone to teach him a practice and then don't tell him it's meditation. It'll work. He just has to know that for him to meditate successfully, he just has to know, like, get tricked into meditating. So I'd say that a good technique for bigger B1 is, so I'll share you guys one technique for people who are frustrated with meditation, okay? Then we'll do something to help with depression and anxiety and help Gizmo out. Calm down your sympathetic nervous system. So, this is what I want you guys to do. Close your eyes and listen to the sound of your breath. Listen to the sound of your breath. So your breath has noise. It has a sound. You should be able to hear something. If you want to, you can put your fingers in your ears and then listen. Then what I want you guys to do is try to spell the sound of your breath. So understand that, like, all sounds can be spelled phonetically. Like, it's not going to be a perfect approximation. But what are the sounds? How would you spell the sound of the breath? So we would, for example, like the noise that a cat makes, we spell MEOW. the sound that a dog makes, we spell W-O-O-F. And so how would you spell the sound of the breath? Okay. So now everyone's just typing out random shit. That's a great place to start. So then the question becomes, I want you guys to refine it further and go deeper. Is the sound of inhalation different from the sound of exhalation? Right? So then what are those two sounds? So now what I want you guys to realize is that chances are, and this is going to be hard to understand, but the more you listen to it, the more you're going to be able to refine the sound. You guys are tossing out an answer because that's your first impression. But the closer that you listen, like just look at what everyone's typing. There are like a lot of different dimensions that people are covering. Some people are using H's, some people are using S, some people are using multiple vowels, some people are using one vowel. There are M's, so like, just listen and try to see if anything that anyone has typed in Twitch chat, can you hear their sound? Okay. So now what I want you guys to do is stop typing in Twitch chat, close your eyes, and just listen. Okay. Now I'm going to teach you guys, have we done Darth Vader breath yet? Haha, what's the right answer? You guys do it for a month and then get back to me. Right? So do it for a month and see, like, do it every day for 1 month and see if you understand. So like understanding the sound of the breath is like expanding your palate, right? Like the more you train your palate, the more you'll be able to detect. And so the more you listen, the more you'll get. Like, it's like, you know, if you have an unsophisticated palate and someone feeds you something and you eat it and you're like, yeah, that was delicious. That's what you guys are doing. You're like, this is delicious. This is the sound. So understand it deeper. Listen to it. Really listen to it. And then once you feel like after you do 1 week of this practice, the second step is to see or listen. Where do you hear the sound of the breath in the external world? The sound of the breath is present in other places. Can you find out where? Where do you hear it? It's not just the sound of the breath. It exists in other things. Is to go looking for it. But in order to find the sound of the breath, you really have to understand what it looks like, or what it sounds like. You really have to be able to detect it and understand it well within yourself before you are able to find it in other places. Yeah, Stalkerino. Okay, so now I'm going to teach you guys Darth Vader breathing technique, okay? And it's hard to describe like how to do this technique except to breathe like Darth Vader. So this technique is called Ujjayi Pranayama. And what it is, it involves contraction. I would say do it for 3 to 5 minutes at a time. So it involves contraction of the throat in a way that produces this sound. And if you guys want to know how to understand that with the throat. So if you want to know how to make that sound, you have to breathe like Darth Vader, right? So you go like this. So when you make the Darth Vader sound, you're gonna when your mind tells you to breathe like Darth Vader, it's gonna automatically contract something in your throat. That's what you want to contract. So take a snapshot of how Darth Vader breathing, what it does to your throat, and then do that to your throat, and then breathe normally with that contraction. Okay? And then close your eyes. Close your eyes and practice. We're going to practice for 3 minutes. Go ahead and finish the breath that you're on. Let your eyes remain closed. Just sit with the feeling. Sit with the person that you are in this moment. Okay. Go ahead and let yourself come back. Okay. So thank you all for coming. Thank you for listening and participating. And we're going to go ahead and wrap up for the day. If anyone has a suggestion for who to raid, we'll do that. So I think just to kind of recap, today's stream was about a little bit about lupus, a little bit about anxiety, a little bit about how to change our diet and to sort of optimize our health, what helps with inflammation, but also how to enact simple behavioral changes. How is it, like, sure, we should eat certain things, but how do we go about eating those things? A little bit about the origins of anxiety, and a little bit about meditation.